Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Quick thank you to Eric Zuena from ZDS Architecture. Very interesting insights. They design a lot of hotels, a lot of workspaces, and what the future may be. We'll have a write-up on that tomorrow. I also want to thank the chair of the Political Science Department at the University of Virginia, Jennifer Lawless, who gave great insights into the Trump-Biden battle that is now emerging hotter and heavier than before, and peeks at to what she thinks about the emerging battle between the White House and the governor of North Carolina on the future of the Republican National Convention down there in Charlotte. Let's go to Dr. Michael Fine. Dr. Fine, thank you so much for joining us.
Great to be here, Josh. Good afternoon.
Yes, we're officially in afternoon land. Yesterday, Governor Raimondo said, we know so much about this disease. We know so much more than we used to know. Those fly a little bit in the face of comments initially tweeted by Megan Ranney at Brown University and others who, and yourself, who constantly reiterate, we know so little about this disease. Do we run into trouble when politicians affirm things that we just from a science standpoint don't know enough about yet?
Well, I think we do better when we let scientists talk about the science. In this case, we certainly know more than we did, but if we knew enough, we wouldn't be seeing the transmission of the virus. So we don't know near enough. Our testing isn't near good enough. We don't have a treatment, we don't have a vaccine. So yes, we know more than we did, but are we ready to battle this virus and beat it down into nothing? We're not close to that yet, unfortunately.
And doesn't our knowledge only unveil how little we know? I don't mean to split hairs, but what we know now is we don't know anything. We didn't know that at the beginning. It really appears that when you go through the checklist of what you know about a disease, we're at the 1 yard line seeking to go all the way to the other end of the field. We're not exactly at the 50-yard line on this virus.
Yeah, again, I don't know how to measure it. We know more than we did. Science is a relatively slow process that takes time. And the good news is we get to learn every day and learn more. That doesn't mean our knowledge is perfect. We make guesses. The guesses are proven wrong. Sometimes they're proven right. We learn from our mistakes. That's a healthy process. That's empiricism. That's kind of how we learn to sort of deal with the world that we are presented with. And I think it's healthier for people, for us all, to acknowledge what we don't know, and to admit what we don't know and sort of say, gee whiz, we don't know that we know some stuff. We don't know lots. We're going to proceed from an abundance of caution, and make sure we do our best to protect everyone as we're learning. And I think the notion that as we're learning, we all learn together, that's pretty healthy.
Yeah, absolutely. Can you take us through the numbers locally, nationally, and globally?
Sure. Well, we don't have new numbers from yesterday yet. Hopefully they will be released right before the governor's press conference. Internationally, 5.719 million tested positive cases. We will be at 6 million in 2 or 3 days. A very painful number for me, let me tell you. But that's a number we're going to see. 2,456,000 people recovered. Our number of cases, by the way, are still going up around the world at 50 to 100,000 cases a day. In the U.S., we are at 1.73 million cases, still going up at 20,000 a day. So unfortunately, though our deaths have been lower, our reported deaths have been lower in the last 10 days or so, I'm afraid we're going to see them come up again before too long, though I hope not. Around the world, 353,000 reported deaths. going up about 3 to 4,000 a day, maybe 5,000 a day. That's been pretty steady, up and down, but pretty steady in the United States. In fact, we crossed over 100,000 deaths yesterday, going up at roughly 1,000 a day. That's better than a couple of weeks ago. But again, looking at the number of cases, we may see a bump in that. Unfortunately, in Rhode Island, we are at 634 deaths so far. We'll have a change in that in a little while when the report comes in. Hospitalizations, hospital bed use continues to go down, and ICU use continues to go down. That's a good thing, but we'll see what happens as a result of the opening up of things over the next 3 or 4 weeks, which is when we'd expect to see an increase in cases.
Is the governor smart to keep the Overflow hospitals at the convention center and in Cranston? And I'm not sure if North Kingstown's still standing, but at least keep one of those units available as we reopen the economy, move into phase 2, and then potentially at some point move into phase 3.
Yeah, I can't comment on that really. We've been lucky insofar as the hospital bed use hasn't been overwhelming. And I don't have my handle on how much excess capacity we have. Having excess capacity when you're making a change seems like a good idea until things stabilize again. How much excess capacity is needed? I think we get a sense from looking backward, and I haven't done those projections.
Providence Police has announced that over the weekend they broke up a significant party, 300 people plus, on Broad Street. There's been a tremendous amount of energy, maybe not always perfectly distributed to get the message out by the governor, by state government, through the media. Is that the lack of messaging, or is that just people ignoring the message?
I think it's a little bit of each. I'm not sure the messaging in all our communities has been perfect. I think the value proposition for young people is weak. So for me as an individual 19-year-old, I've got relatively little risk myself, and I may not be somebody who sees things 30 and 40 years down the line. I think it's all those things together, and it's spring and summer, and people will be people, kids will be kids, and somehow we have this dynamic tension that we have to address of people wanting to be together. That's a good thing, and the realities of the risk that involves, which is challenging.
On that theme, though, there is repercussions. Mitch Daniels, the president of Purdue University, in an op-ed piece in the New York Times 3 or 4 days ago, made that argument, which is, hey, listen, spread amongst young people, the health risk is minimal. A lot of faculty on the Purdue campus pushed back and said, we're 60 and 70 years old. There's a tremendous risk to us.
Yeah, and the question is when the risk hits and how you mitigate that risk. And this intergenerational conflict is I think inevitable, because our faculty who are 60 and 70 also aren't the people who have gone out of their way to make student loans go away. We haven't done for young people what we're asking young people to do for people who are 60 and 70. So it kind of goes both ways. It just happens that people who are 60 and 70 are in positions of relative power, and that changes the dynamic considerably. We'll see how this plays over time. Governor Daniels, he was the governor of Indiana, if my memory is right. It's going to be really interesting to see in the fall, if he opens the university, what kind of testing he'll use for young people, and whether by that time we have testing that's meaningful and effective. Lots on the table, but I don't think there's a right and wrong. I think everybody's got to work this out and remember that our job is not just to take care of ourselves. Our job is to take care of each other.
The, the wearing of masks is now becoming politics 101. It's blue versus red. The president's fueling it. Democrats are biting back. In Rhode Island, initially the governor said, don't wear a mask. She's now changed that. She's been pushing cloth masks of some kind. And there's questions about what the effectiveness of that is. How do we get out of this dilemma, this political cycle in which, literally, to your point, protecting each other is now becoming as much of a divisive issue as, gun rights?
Well, it's the problem, the individual freedom question. And I'll go back to Franklin Delano Roosevelt's Four Freedoms and think about not just freedom itself, but the freedoms that matter. The freedom of speech, the freedom of religion, the freedom from want, and the freedom from fear. I think, I think we are bigger people than getting stuck in deciding that whether I wear a mask or not is an expression of my individual freedom. It's like, you know, it's trivial at the end of the day. We've got to find better things to work on so we're not fighting with each other. Nothing. And our failure to do that actually was our failure in this pandemic, so that we had to close the economy, essentially, instead of preventing the spread of this disease. We have not yet owned that collective failure, and not yet decided, based on that failure, that we got to change what we're doing and how we think about each other. Because I'll say this again, this is not the big one. The big one is out there and coming at us. And if we can't get past fighting with each other, the big one's going to eat us for breakfast.
Yeah, yeah. Dr. Michael Fine, you get the last word. What do Rhode Islanders need to know about the coronavirus?
Well, going back to Franklin Delano Roosevelt, who said there's nothing to fear but fear itself during the Depression. Our job is to sort out facts from fear and to act on facts only. We've got to remember to see the world as it is, to enjoy the world, to learn from it, and to be together every minute of the day. And no dumb virus ought to get in the way of our taking on that process.
Dr. Michael Fine, thank you so much. For everyone else, we'll be back at 12:30 with Lieutenant Governor Dan McKee, and then at 2:30 we'll be carrying the governor's remarks. Thanks everybody for tuning in.